let's go through the consultation forms for your assessments. So we're going to do 2 consultation forms for your assessments. So we're going to do the intensive skin analysis form, and we are going to do the level 3 entry to aesthetic form. So this is the form that you are basically being assessed on. It gets sent to the IQA. It's assessed by the assessor. We do not put any personal details on this form due to GDPR. Obviously, we put the personal details in this form, but this form does not get sent to the IQA or the assessor. This doesn't actually count as part of the assessment. However, the assessor and the IQA will want to see you filling this out and asking your clients. There are elements of this form that you can fill out before you do your consultation form. For example, client name. So we're just going to put their first name, GDPR, the date, your name, the age range. Again, we're not asking the date of birth, but the age range. And then we can do the time started and time completed after the facial. You need to sign here to say that you are aware of the assessment criteria and you'd like to be assessed. This is the tutor details. Generally, the tutor is going to be someone that is helping me out, or I will be the assessor. Then we've got consultation techniques. So we're going to use all of these techniques. We're going to do questioning, manual, visual. We're going to refer to the client's records, skin analysis, assessment. So we're going to tick each of these boxes. And then whether it's a new client or an existing client. So this little element can be kind of completed before your client comes. You're going to know the name. You can fill out this bit, do your questioning techniques. Obviously, you can fill this out when the client gets here or at the end. Their client age range based on the date of birth on your intensive skin analysis form. Skin type, skin condition. This is obviously going to be completed afterwards. Did they have combination oily, dry skin, mature, sensitive, dehydrated skin? Necessary action, equipment, products, massage techniques. Again, this can all be filled out when your client has gone. So necessary action, modifying the treatment. Did you need to modify the treatment? Encouraging the client to seek medical advice, explaining why the treatment cannot be carried out. Comments. If a client has a contraindication or a contra-action and they cannot have the form, this is where we would pop it in here. Although generally for the assessment, that is not going to happen because I'll make sure all of your models can have the treatment. However, on one of your assessments, you'll have 3 assessments on the day. So you'll be filling out 3 of these forms. We will modify the treatment. So for example, a client doesn't really have any comedones, so we don't necessarily need to do the extraction, or they don't like heat on their face, so we don't need to do the steam. We'll pop in here why we've modified and how we've modified. Equipment. So we will be using a magnifying light, we'll be using an extraction tool. We'll be using our fingers, so you can obviously tick this area, but just say we use fingers to extract. Skin warming tool is our steamer. Consumable, so this is all going to be ticked. Products, cleanser, exfoliator, masks, specialized skin products, our eye cream, which we will be using, toner, moisturizer. We're actually using a non-setting mask. So a setting mask would be like your clay mask, for example, but I would have, 2 of your consultation forms, you'll pop non-setting mask, and on 1 consultation form, you'll have setting mask. Massage techniques, we will be doing effleurage, petrissage, and appointment within the treatment. Adjustments. Adjustments would be, let's say, for example, one of your clients has a slightly bruised chin, then we would obviously just avoid that area. So one of your forms, I would put an adjustment. And then cream and oil. So generally we are going to use oil within the treatment, but one of your forms needs to state that you've used cream. So in one of them, you'll need to just alter this area. One of them, you'll need to have an adjustment. One of them, for example, use a setting mask. And in one of them, you will be modifying the treatment. Client communication, client care. So we'll be doing verbal, non-verbal. We'll be writing down, we'll be talking. Advice and recommendations, we'll tick here because we're going to give them advice and recommendations. Was your client comfortable? You tick here. Was there a complaint? If there was a complaint, we'll put the details down, but hopefully that is going to be a no. Client care and aftercare. Again, we can fill this out afterwards. Maintenance and aftercare advice. Was this given? What did we say? Treatments and product recommendations. What have we recommended? Avoidance of activities which may cause contractions. So a contraction is something that can happen after you've had the treatment. So let's say we've told them to avoid heat. They then go in a steam room and it causes irritation. So we would just put in here, obviously, the aftercare, avoid heat, avoid saunas, sunbeds, steam rooms, for example. And I would just copy this question in here. They're very similar questions. To be honest, this whole section and this whole section can actually be completed, some of it before your client comes, and then the rest at the end. The one element we absolutely must get the client to sign before you start the facial is the client's written and informed consent statement. So without informed consent, the client should not be having the treatment. The client needs to sign that they act to be a model and receive a beauty treatment, and they have and that the information that they have provided regarding medical history is accurate, and they have to sign here. So this is the assessment form. This is the consultation form. So you will, when the client comes in, you'll do the consultation form first, and then you will hand them over this element. Can you just sign here for me? This just confirms that you agree to act as a model. The information you have given in the consultation is accurate, and then that you have received all the information from me that you need and you're happy to go ahead. Client signature. This is the most important part. The assessor will want to see that being signed, and the IQA will want that to be signed as well. Client comments and signature, they fill that in at the end. So realistically, the only element of this form that is being filled out by the client is the signature once you have given all the information. Client's comments and signature, they give that at the end. So they're going to give you some comments on the facial, and then you'll evaluate your client's feedback. For example, your client said that they loved the massage within the facial, the steam was really nice, or they weren't too keen on the extraction, as an example. And then this page is for the tutor, the assessor, to complete, so you don't need to worry about that element. So that is the first form. This is your assessment form. This is the form that gets sent off with your paperwork, with all the consultation forms, and it is in line with GDPR. Obviously, this one is just for our files. So this form is important. However, generally it doesn't need to be filled out when the client is there. You can fill out as much as you can pre-facial, and then you can fill out the rest post-facial. However, once you've done your other consultation form, please, please, please get this signed before you go ahead with the facial. And then the intensive skin analysis form, I will upload a practical element of this, a practical element of me doing a consultation with a client to give you an example. However, just to go through it quickly, so you're going to put your student name, date, and then our assessor name, which would be me or another assessor, and the date. I tend to give my client the clipboard just to fill out these personal details, and then I want to go through these questions with the client because I'm going to ask questions if I need to. Do they have any medical conditions? Are they taking any medication? Do they have any allergies? If so, ask them about it. Skin disorders, you can ask them about skin disorders. The form covers skin types, lifestyle, environmental factors, how much water do you drink, how much sleep do you get, what's your diet like? If the client comes in and they've got hydrated skin, are they drinking enough water, for example? Skincare routine, what products are they using? Do they use products in the morning? Do they use products in the evening? This is where we can potentially give recommendations within that consultation. Do they have any weekly treatments? What are their skin concerns and goals? And you can literally just read through these and speak to your client about it. Recommended sessions and alternative treatments. Generally, when we're doing the assessment, I would potentially recommend just 3 standard facials over maybe a course of 3 months. And then we could potentially look at alternative treatments. If, for example, they've got pigmentation, we could potentially recommend microneedling, or they've got super dehydrated skin, but they're drinking lots of water. We could recommend skin boosters for hydration, for example. You've got your observations. So this is the element that you would fill out when your client is steaming. You would pop in your observations here, get your clipboard out, fill out what you noted in the skin consultation in this little element here. When you're doing your facial, you really don't want to be sat there not doing anything. So if ever there was a moment, i.e. during the steaming, this is what you would do here. And then you would get your client to sign here, you would sign here, your assessor will sign hers later on. And then that is the end of that form. So on your training day, you'll come in, I'll explain everything to you, the way we're going to do everything. At the end of your bed, you'll have your forms, you'll get your client to come over, you'll have your 2 forms here, you'll go through the intensive skin analysis form with your client. You will have filled out some of this anyway. You would then just skip to informed consent, make sure the client is happy to act as a model, get that signature, and then that is your forms finished for now. You would then do your facial, update your notes during the steaming session, everything you've witnessed in the skin analysis, and then once you've finished, you would get them to come to the end of the bed, you would come back to this form, and you would get your client just to give their comments and a signature. They would also then fill out a feedback form, which will be within your file. I would then personally ask your client to go and take a seat, flick through the forms, make sure you've got all your signatures, and then your client is free to leave.